If you could take your seats, the meeting started 2 minutes ago. He is,
Yes, he is, yeah.
We've got apologies for Guy.
Yeah, he's in Italy. Guy and Laura, I presume.
Okay, hello everybody. Reese, sit down. So, agenda item number 1 is apologies for absence, declarations of interest, and any other communications received from members. Bill, we've got apologies from Councillor.
Councillors Lambert and Parisato.
Any declarations of interest? Any members received any communications? No. Members asked to note the monitoring officer's guidance on members' declarations of interest. And so now we had 2 discussion groups at the back. One was about Lime bikes. One was about future ideas for the area forum. I hope everyone who wanted to join them at some stage did. We're going to have feedback from Councillor Williams and Councillor Sharma, who chaired those. Which one do you want to hear first? Feedback on Lime bikes or future ideas? Future ideas from Mel was the only person who answered. So, Councillor Williams, over to you.
Thank you, Councillor Barry. I'll just hold this aloft, this lovely collection of all the wonderful things that came up in our conversation. So the 3 big takeaways were, oh, sorry, am I not speaking into the mic enough? Was about development in Brentford generally, understandably so. Lots of questions around developers, social responsibility, SIL, all these sort of things that we do, to be fair, often cover quite a lot, but always need to do more and explain better. TfL, bus routes was another thing that came up. Youth support, what sort of services are there for 14 to 16-year-olds was I thought, a very interesting one. And then one that I really liked was emphasising the good in Brentford. So someone was saying, you know, celebrating what we actually do well. We've got the Canal Festival, the music nights, Creative Mile, the museums, Brentford FC, you name it, lots of things. So I thought I'd just add that in, that there is lots of good things to talk about in Brentford too.
Thank you very much. Councillor Sharma.
Thank you, Chair.
And her beautiful assistant.
Thank you, Chris. So we had a discussion on Lime, and if I'm honest, I thought it was very proactive and very positive. We discussed with Lime with regards to the hacking and the bays, they have explained that they will take everything on board, and we will work together with Lime representatives and also with the officers. It wasn't a negative group of people that we were talking to, and overall it was positive. I felt that it was positive. Thank you.
Great. Just to say as well, in previous area forums, the police have done a presentation, an update. They're not doing one tonight. That's I think, better suited to the neighbourhood panels where the police engage with the residents. But the police have been here in the marketplace, and they will stay around for another 15 minutes. If you wanted to talk to the police and haven't had a chance to, they are outside, but they will be going soon. So on to number 3, update on health services. So first up, we have a presentation by Dominic Conlin, who is the Hospital Director at West Middlesex Hospital. It's a hospital some people here might be aware of. Dominic, very glad you're here. And Dominic, I believe it's your anniversary tonight. You've come here.
It is, Dan, yeah.
In trouble with his wife to be here to speak to us. So thank you extra specially for coming.
Thank you. 24 years ago, so it's got to the stage now where that's not quite the disaster it might have been a few years ago if I actually missed it. Although I won't tell you what I had to buy her over the weekend. So thank you very much for inviting me here tonight. I've had a quick brief. I'm hoping there are a few slides. Great. To be brief and to be fairly punchy about some of the things that we do, give you a bit of a flavour of the activity that happens, both across the wider trust. As some of you may know, Chelsea and Westminster and West Middlesex merged in 2015. A little bit about our plans, the outcomes we provide, and some plans for the future. So what do? So the numbers there, I'm not going to go through numbers. Councillor Bowring counselled me against lots of facts and figures and trying to be overly stato. Those numbers, the point I'll make here are for the whole trust, not just the West Mid site. But the main point I want to emphasise here is one of scale. There are a number of advantages to being part of a larger organisation, particularly around some of the infrastructure that supports us, the way we've been able to recruit certain consultants and run bigger rotas. My own observation, and having talked to some of the doctors about the strikes that are currently going on and have been going on since March, is that we would really not have been able to have the resilience to sustain some of those days without being part of a larger organisation, without having very big consultant rotas, and without having the ability to sort of flex staff across the 2 sites. A couple of numbers I will pick out, just because, if you're anything like me, those numbers are just so big, they're almost a bit unintelligible. But in the accident and emergency department at West Middlesex, we treat 20 patients an hour, every day, which gives you some idea of the sort of scale of the department. It is one of the busiest, despite being one of the smallest hospitals in London, it's actually one of the busiest A&Es. And in fact, it is the busiest A&E in London from the hours of midnight to 6 in the morning, which is partly explained by how big a local employer Heathrow is and the type of shift working that happens on that site. But also at the other end of the clock, there are a large number of people on 0 hours contracts or gig economy, and then by the time they look to access other bits of care, or a member of their family needs to access care, the only place that is open is the Middlesex site. So an incredibly busy site for the size of the whole hospital. And just in maternity, we're really proud of our maternity services. They were rated excellent by the CQC, a rating we maintained earlier in the year, despite all the national focus on maternity standards, so we're really proud of that. And on average, a baby is born at the West Middlesex every 30 minutes. Every 30 minutes of every hour of every day of every year. So again, some incredible scale that the services work to, and the sort of things that our amazing staff sort of really push through on. Specifically about the site, it's about 500 beds. As I said, I won't go through all of those areas. It is a local hospital. It's fundamentally geared to supporting the local population. Got a couple of plans, but I'll take going forward, where we know there are some poor outcomes, but in general, the outcomes are very good. A little bit about the investment we've made in the last 7 years. Again, I won't go through all of these, but there's been about 35 million pounds worth of investment on the site in the last 7 years. The bigger developments are post-Wave 1 COVID. We significantly upgraded the ITU and put some more clinical capability in. We put a new cardiac catheter laboratory in straight after the merger. And this year we've put a new discharge lounge in, which is sort of speeding up it basically allows us to have patients waiting for their trip home, not in a hospital bed, but in a purpose-built discharge facility, and it allows us to sort of pull people through the A&E system and put them in a bit quicker. So how do we do? Again, I'm not going to go through all these stats, but a slide we've used and has been very effective with the Care Quality Commission and with other patients groups is this one. As a trust, we have 3 strategic priority themes: quality, workforce, money. And these are the 3 standards that the board look at every month as an indicator of how we're doing there. And from the bottom, so we've been able to have a surplus every year since we went through the merger. That's getting more difficult as the financial pressures bite, but we still managed a surplus last year. And why that's important is because it allows us to retain a level of self-governance about how we invest in our money. That money I talked about investing in the estate previously, the money about our plans, on my next slide, we would not be able to do in the same way. We would not have that same level of self-governance if we were a hospital in deficit. So reinvesting in the estate is an important principle for us. But so is the principle of demonstrating good value for money to the taxpayer, to you, the people who pay for our services that come through each year. We've actually managed to increase the number of staff working across the trust year on year as services have got more pressured. But again, an indicator of the way we've been able to maintain productivity. And the one we're most proud of is that top slide, is something called, snappily titled, the Standard Hospital Mortality Index. What that means is it's a very crude measure of quality, but it's the deaths in hospital or within 28 days of hospital that all hospitals are nationally measured on. And it basically rates the services, the complexity of the services you provide. It rates the complexity of the population that we provide to, and it measures what the Public Health England would expect the number of deaths to be. And they normalise that at 100. Every year we've been below that, and are now at 72. And I'm really proud to tell you that on that basis, Chelsea Westminster West Middlesex is the safest hospital in the country. I'm hoping the next slide.
Gary, we've got a slide issue. Oh, yeah.
There we go. So a little bit about, next one back, please. Thank you. I just wanted a little bit about the where we're going with the plans. It's not as clear as it might be on the slide. Basically, we've got a really ambitious site plan about developing services. It's a bit difficult to say exactly where they all are in terms of that, but fundamentally we've got a plan in place, which I'll speak about in a moment, at the very back of the site, called the Ambulatory Diagnostic Centre. So those who know, it's on just off Park Road and Hebwell Close. The one immediately next to that is now not planned, where we were going to put some houses. Oh, thank you. Thanks, Dan. Yeah, that's the Ambulatory Diagnostic Centre. The one next to it, that's now not planned because simply because of the disruption that would cause residents by having two levels of investment. And then across the rest of the site, the next set of plans, the next one we'll do is actually 3A, where we're likely to put a multi-storey car park in place and free up some of the floor space. Those of you who know West Mid know that it's all ground level car parking only, and that's not giving us the best sort of use of the estate. So we're going to put a multi-storey car park along there and then potentially redevelop our maternity services where the current car park is, so that and connect it to the site with a bridge. And then the rest of the site we'd like to free up for other healthcare or other social service facilities, social care facilities, and accommodation for staff. We believe we're able to offer good, reasonably priced accommodation for staff that would attract healthcare staff. It might also attract social workers, ambulance drivers, teachers to the area. We think that that's probably the most effective way of bringing staff in, which is probably our most significant strategic challenge, is actually bringing staff in and recruiting. So a really ambitious plan. We've discussed that with the council. Councillor Burrow and Catherine Dunn thought that you'd be interested in these very outline plans. The only one that has formal planning permission is the first one I mentioned, the one back there, the Ambulatory Diagnostic Centre. We're currently negotiating contracts with that. We're expecting to start building in January. It's a purpose-built 5-storey building at the rear of the site where we'll be able to put MRI, CT and other diagnostic equipment, which will speed up access to that kind of diagnostics for the local population. We will be doubling the floor space we've got for local renal facilities and doubling the space we've got for local cancer and hemato-oncology facilities. The reason we've chosen those services is because, in conjunction with our commissioners, sadly, the outcomes for the people of Hounslow in renal disease and cancer are amongst the worst in London. And part of that is because there's no immediate local access. You have to travel into London for some of that. And it just slows everything down. So our belief is that if we can provide those services on site, will uplift the skill base of all of our staff, but most importantly, we'll be able to provide more services and closer access to for the people of Hounslow. So it's a really ambitious programme. It's about a £65 million programme. It's the largest single capital development my trust has ever done. So I'm really pleased that it's happening here locally. I'm going to pause for breath there. I don't know whether there's questions now or whether we go through all the way and then we do questions at the end.
Thank you, Dominic. I think maybe we'll hear from Mark first, just in case any of the potential questions are either answered by him.
Thank you, I'll happy to answer any questions later.
So this is Mark Jarvis, who's the Assistant Director of Primary Care Integration and Delivery. So Mark, over to you.
Thank you. I'm going to give you a very, very quick overview of primary care in Hounslow, and then Dr. Chalmers Watson is going to give you a much more detailed description of what goes on in this particular area. So in Hounslow we have 46 GP practices covering a registered population of just under 350,000 patients. Those practices are currently split into 5 groupings called primary care networks, and you'll see there those 5 networks are Chiswick, Brentford, Hounslow Health, Great West Road and Feltham and Bedfont. We have recently, as an organisation, taken on responsibility for opticians, community pharmacy and dentistry. Previously they were the responsibility of NHS England. That's now been delegated to local decision making. The primary care networks are basically groupings of GPs which enable the GP practices to work better together, to provide a greater range of services, to ensure patients can access those services much more easily. It enables the practices to think about how they can distribute their expertise and workforce across the patch to make sure that the services are accessible for patients. Primary care networks are also able to employ a greater range of professionals. So many of you will have seen pharmacists in practices, but in addition to that, there are staff who are social prescribers who will support people to look at alternative ways, non-medical ways of resolving some of the concerns that they may have. But there are also physicians associates. They are clinicians, but they're not at the same level as a GP, but support the GPs in their work. Physiotherapists, paramedics, healthcare professionals, healthcare assistants, nurses, and of course GPs. So there's a whole range of professionals that you will see in general practice today that weren't there a few years ago. And that enables the PCNs to develop more services for patients. I'm not going to cover that slide because that's irrelevant for this evening's purposes, really. Just in terms of the priorities for primary care in Hounslow, I'm going to leave Dr. Chalmers Watson to talk about improving access, because that's one of the things I know that residents are particularly keen to hear about. But the other priorities are making sure that patients have an equal access to services. And one of the things that we are prioritising at the moment is making sure that all those local residents that need access to winter vaccinations get those vaccinations. So making sure that we reduce what we refer to as inequalities, but making sure everyone has the same access to services. Developing neighbourhood teams is about making sure that we work in a more integrated way so that services work better together and not in silos, as very often happens across health and social care. And we want to make sure that we are increasing the way in which we talk with and engage with patients across our networks. And as I indicated, we're just about to start that journey of working more closely with community pharmacists, opticians and dentists locally. I'm going to hand over to Dr. Chalmers-Watson, who's going to talk a little bit more detail about things locally.
Hello, my name is Dr. Chalmers-Watson. I am a GP from Brentford Health Centre, which is 100 metres over the road, and I'm the clinical director. There's actually 2 clinical directors for our PCN of 60,000. We are acutely aware that it's been a challenge to get in to see GPs, and our priorities are therefore to make that easier. We have now got 6 of our 7 practices using a new telephone system called Louiscom, which has reduced our waits significantly from, I don't know what the average wait was, but people were getting over 10 and 15 minutes, down to the average of 5. So that's 6 of the 7 practices have got Louiscom and the ability to call back and the ability to manage it much better. That's one practice that hasn't, but that's a great improvement, and we're working on that one. Now, over at COVID, we worked out that you could book back appointments by sending people SMS links. And last year, all the practices did COVID and flu by sending links, but now practices are doing lots of things by sending SMS links. And they'll say, have your child had flu vaccine come, or health checks, or asthma checks, or SMR checks. So every time we send SMSs, that liberates us from people phoning our phone lines. Our priority, my priority, is shorter waits for telephones to be answered, because actually it is really soul destroying for our staff, and we've had a great turnover of our reception staff. So for everyone, your sake, everyone's sake, we want to reduce the waits, and they are better, though I'd be love to hear any feedback. Again, what can you do without phoning reception? You can use the NHS app. The NHS app allows you to look at hospital appointments, allows you to cancel GP appointments, allow you to look at results without actually phoning reception and saying, what was my result? So using the NHS app is one of our priorities. The vast majority of over 13-year-olds have the NHS app downloaded. I was going to give you a percentage, but it's forgotten it, but it's the vast majority. Now, we've given everybody the option, if they want, of using e-consultations. Now, that's primary patches, because it is easier than what we used to use, which is e-consults. But again, I'd love feedback. But one practice using Accurex. Accurex is great. We love Accurex. So if anybody's got any feedback from that. And then increased appointments with ARS staff, as unfortunately the number of GPs has declined, despite it being an aim to increase it. So there's now 1 GP, full-time GP, per over 2,000 patients. So it's going in the wrong direction. So we have got new staff. Now, we're aware that there's been a great amount of mental distress and ill health. And so one of the things I'm really pleased about was we employed a mental health practitioner, and he had 30 years of working in secondary care, and he is there to help people who need specialist help without the long waits to see secondary health services. So if people have been discharged from secondary health services but have an acute exacerbation, he's ideal. And again, people can refer themselves there through patches and say, I need to see him. Now, he's not got a caseload. He's there to help people in crises. He's a first contact mental health worker to try and stop the wait to mental health, and appears to be working. And the other people I really want to bring up, because it's different, is social prescribers. Now, Social prescribers are there because we know that people's physical and emotional health is significantly affected by their social situation. If you've got diabetes and live in a flat and are scared to leave the flat or can't get down the stairs, your health is going to be much worse than if you can go to the allotment, make yourself grow fruit and veg and cook it. So social prescribers are there to get people less isolated, because isolation is really bad, particularly as you get older, for your physical and mental health, and to get involved in structured community activities. And it also is there to help problems like debt and hoarding, all these problems which are significant to the people who are affected. And they want to help people to get new skills and to find support for patients through non-government organisations. Okay, so now the other major priority is inequalities. To affect people's long-term health, the thing that we can most easily affect is actually blood pressure control. So our digital team, our pharmacy technicians are leading on diagnosis of essential hypertension and getting blood pressures to people in their homes for periods of time to try and get good control, whether that's been after a stroke or whether it's been with people who've never been ill before. And this is called blood pressure at home. So people are being offered blood pressures at home. They are given text messages to record their blood pressures at home, and it goes into our system. And then if they need any other tests, investigations, treatments, it is organised. Health checks, again, there's the inverse care law, so the people who come when you get a text for a health check is often the people who least need it. So there's a real push to get health checks to the most deprived population, and to do that we've got a roving team in an ambulance. Now, we are delighted for that to go to community events organised by anybody, but ideally in the most deprived area. And you can send us, we're organising this event, there is going to be, we expect 500 people there, and we will get the roving bus to it. And there is an email address on my slides for the PCN, and contact us and give us warning. 3 months, but most events are, but we will try and get, I want to use this ambulance well. I'll have a real focus on screening. We got the lung checks into all our 7 practices. It should be on our websites. So this is anybody who's a significant smoker, so there's a questionnaire, over the age of 50 can get a CT scan of a chest looking for early signs of lung cancer. This is new. I would be delighted to share it with you. We want to get it publicised. Our cervical screening rates are slightly lower than we would like them to be. So we have started Saturday clinics, and again, text message gets sent to people and you can book it. So you don't need to spend half an hour on the phone booking a slot that works. You get sent a link, and then you can think, oh, these are the options, this one I can manage. So, at the moment, it's bowel screening month. So we're encouraging through text messages, through other means, for everyone in the ages brackets to have bowel screening. Bowel screening is increased rates of bowel screening. We're not entirely sure why. And it's in younger ages, so we're moving down the age brackets. And lastly on the screening, we are encouraging, as a PCM, prostate cancer screening with a blood test for people who are at higher risk. So that depends on multiple factors. So those are our priorities this year. Another priority is diabetes. We have 3,200 diabetics and another 3,000 people at high risk of diabetes. And we are encouraging every single one of them to sign up for No Diabetes. This is it's done by Northwest London and has got tens of thousands of people on it, and it's kept up to date. So all the offers from public health and for all the apps to low carb or second nature to help you lose weight are all on it. And actually I've had very positive feedback from everybody. Yes, there's some nods, but I'm delighted to have questions. Lifestyle medicine is incredibly important for many people, but particularly diabetes. So there is, the offers now are Healthy Hounslow. You can self-refer. So this offers Buzzy Bees, which is if children are overweight, this is exercise and healthy eating. There's a healthy cooking group. There is a weight loss group. So that's 11 weeks of weight loss. So, and these, I would love these shared if there's any notes, because you can self-refer to both of these. Every diabetic, we would like to go to the expert patient group course. So this has been proven to help long-term management, people to learn about what is diabetes, what you can do about it. And if after all of that, we do have a dietitian, but we have one dietitian who works not only, and if we've got 6,000 patients, we would like everyone to do the stages before that, before they have a one-to-one with a dietitian. That can be online or face-to-face. Now, the next slides are...
Sorry, Julia, I'm over here. Hi.
I can finish. Any questions?
No, if maybe just so there is time for questions. I don't know how much longer you've got. But maybe we could... That's
fine, okay? These are just, you can just look at, these are the things that I'd like to encourage people to do, which is all the IT, but that is fine. I would love everyone to download Patches, who's in the practice, who uses Patches, and download the NHS app, in summary.
Wonderful. Well, shall we firstly show appreciation to these guys for coming? Thanks so much. And I think Julia used to be my GP. Were you a GP in Isleworth?
Yes.
The Wellington Road. Do you have my GP?
Argyle, that's right.
Argyle Health.
Well, it wasn't before Argyle.
Oh, well, since you left, it's still fantastic. Okay, so any questions? Got Mel Collins in the front in the yellow, stunning yellow polo shirt, khaki jeans, very fetching black shoes.
Yep. Wear jeans. I've never worn a pair of jeans in my entire life.
I'm going to assume that's not your question.
I wouldn't be seen dead in them either. I actually sent my questions in, but they seem to have got confused. So I'll be brief. And yes, Dr. Chalmers-Watson, I have seen many times. So my questions are this. When I was involved quite deeply in health, it was envisaged that there would be 6 community health hubs across the borough, one envisaged for Brentford and one for West Middlesex for this particular area. So my question was point A and B. What advantages are the community health hubs going to have for the people in the Brentford area? And what's going to be the difference between having a community hub here, a community health hub here in Brentford, and one at West Middlesex? And would there be different services that people in Brentford could access? Whilst I've got the mic, I must take Dr. Chalmers-Watson to task because her entire presentation assumes that everybody has access to a phone with an app. And
I did add you could have face-to-face dietitian. We would just like it beforehand. And we're trying to help you to get through on the phone. So what we want is the people who can use apps to use apps so that everybody else can get on the phone. So it is with you in mind. And you can still come to reception if you wish.
I'll finish because the other important thing is that particularly a high number of elderly people don't have access to the website full stop. And so I do hope that these presentations that we've seen this evening will take that on board and keep it in mind. Very quickly, my other question was that there have been a number of new developments in this area, some of which had actually had health provision built into their infrastructure. But the health service in its infinite wisdom decided against actually using those facilities. Can anyone on the top table tell me why? And with the growing population in and around Brentford, Are there any plans to revisit these sites, because I understand that they may still be available? Thank you.
I can answer that last question very quickly, and then I'll pass on. So I don't know about the other health areas, but I'm delighted to say that the Council have awarded over £1 million in grants, community infrastructure levy, to the Ambulatory Diagnostic Centre. So we are really conscious that some of the developments are growing the population, and therefore you need to invest in the infrastructure to support them. So I can certainly pick up on that one.
Thank you. The issue of hubs, we thank you for the questions in advance. We were able to see those. We've looked the issue of hubs. I think you might be referring to how we were looking at creating our health centres into bigger type of units that were a little bit more than just GP practices. So the idea that there is still a discussion to be had and being had around Brentford, because there is a site there that we would very much like to develop to include a broader range of services, but there is a feasibility study being done on the Brentford site. And in terms of what benefit that would bring, it would bring a greater consistency of services and a greater spread of services into one place. So it's would be more of a one-stop shop, if you like, for patients, so that they would not have to go to a number of different locations for services. That's the ethos behind creating these types of health hubs that we would be looking at. There isn't a plan at this point in time for anything on the West Mid site to do that, but we are constantly looking at the opportunities for developing the estate and looking at how we can integrate services more across health care and social care. So I wouldn't say never in terms of the West Mid provision. The other issue that you raised about whether or not we have chosen not to proceed with certain developments that might have had a health component, we are constantly looking at those opportunities, and we work very closely with the council and the planning departments to identify opportunities, and the SIL discussions and the Section 106 discussions happen very regularly between the health team and the local authority team. So we are doing that constantly. And just one final point, picking up your comment about not everybody has access to digital, I think just to reinforce what Dr. Chalmers-Watson said, if everybody who does have access to digital was to make absolute use of it, then that would free up the phone lines for those people who don't have those digital services. So everybody wins, basically.
Brilliant. Thank you so much. And we've got Julie just in the middle there.
From Claypons, as everyone knows. Can we come back to being real and getting back to basics? Many a time, I imagine people here, it's not so much having an app, maybe they're taken over from the reception, but you cannot get appointments. You have to give your life story to get through a receptionist. And then they ask you, are you ill? Well, most people only ever ring up a doctor's when you're unwell. The thing is, it's great having all these apps and that, but they're not telling you what's wrong with you. You can go online, you can have all these fantastic apps, but go on Google, you'll find it quicker with what you're doing than what it is. I've been under Brentford Health Centre for, 40, nearly 50 years, and yeah, they are great, my practice side. But the thing is, I feel sorry for the elderly, people who have learning disabilities, who cannot read, write, but you keep saying apps, apps, apps. Where is the real person? You can't get an appointment. They say, is it an emergency? Yes, it is an emergency. I've actually had cancer, and if it hadn't been for my doctor pushing for it, I probably wouldn't be here today. But there is others being told, come back in a week, 2 weeks, 3 weeks. That's not a doctor's surgery. That's an appointment system, just to fit in. So I think you need to go back to basics to look at things going on in the surgeries.
Thank you, Julie.
I'm sorry that you are... Oh, if there's another question, let's have all the questions on the same theme.
The developing master plan for Brentford, or for the centre of Brentford, has a proposal to move the health centre from its present location to one nearer to the high street. Has the NHS got any views as yet on that proposal?
That's a simple answer. I had no idea that was the plan. The plan I've seen is to redevelop on the site. And I've actually seen a 4- or 5-storey building. So I'd be very interested to know where that came from. But I'm not trying to avoid Julia's question. So let me go back to Julia's question. Julie's question. Okay. The demand for appointments is really significant. I'm aware of that, which is why we are trying to get the right person to the right place so that we have got better access. Access is better this year than it was last year, I can assure you. Certainly at my practice it is. So you can actually see me within 2 weeks, which is better than 3.5. So, but I know that's not good enough. But as the number of GPs is going down, we then have to be imaginative about what else we can do. And quite often I see things that I really don't think I do need to see. And that is what I am, you know, it is a limited resource. And, you know, if I'm being called up because I'm being asked for multiple reasons that really it didn't need to see a GP, that's what we're trying to stop, okay? But we only have a finite resource. If you have an issue, the joy about the e-consults is if you go to reception and they have not given you the answer, you then go online, do a patches, and a doctor will see it, or a doctor or a physician associate or advanced nurse practitioner, but a clinician will see that within 48 hours. So if you are, well, it will be seen immediately within 24 hours, but it will be sorted out within 48 hours. So if reception are blocking you, which I know they do, and I wish they don't, and we're spending a lot of time on our reception training, then please do, I know that's going online again, because I don't want you to have to phone each morning, because that's what we're trying to stop. It must be, you know, very, very frustrating.
Thank you. I think next was Andy Ward.
Hi there. Just a little bit of feedback on patches, seeing as I've got a good important person in the room. Patches is actually very, very good. And I used it at the beginning of this year when I was unwell a number of times. My doctor's absolutely fabulous. However, I've been thrown out of the system and no one at the surgery can get me back on it. I've had 4 meetings down there with the people on the desk, and I've actually spoken to the practice manager, and I've probably called in about 5 times. But fortunately, I don't need to use it. But I want to get it back on because it is so brilliant. If you do want to speak to a doctor, they usually get back to you within a couple of days on an email.
Andy, what's your email address for
I've got to shoot off, but I will. I'm not going to give it to you now, but I'll maybe write it down on a bit of paper and I'll give it to you. Yes. So, yeah, it is really good. And if you are able to use an app, I very much encourage that personally because I've had great experience. But for some reason, they've blackballed me.
I'm sure it's nothing personal, Andy.
Do you want to...
I think next was, I saw a hand from Steve Fletcher. Steve, the mic's just behind you.
Yeah, my question is to Dominic. And I'm so excited with all the development plans at the West Middlesex Hospital. But my question relates to, is the proportion of that privately funded investment? I'm not got a sort of prejudicial view either way. I'm just interested. And also, how thinking in terms of Alliance Medical Unit that exists at West Mid, and what that relationship is with the rest of the hospital.
Okay, few questions there. The Ambulatory Diagnostic Centre, which is the one that we're specifically planning, there's no private funding initiative behind that whatsoever. The main site, as many of you may know, is a PFI, as we call it, private finance initiative site. And while there were clearly some advantages originally to that system, in the sense that there's capital that came available to the NHS which otherwise would not have been, there is no doubt that it is a significantly more expensive facility to run than the norm. And you know, we have a contractual relationship to do that, and that's fine. We infinitely prefer corporate style to do things directly and to have a level of influence and to take responsibility for that. So there's no private finance initiative in that at all. It's all been done through, you know, I talked earlier about, quite proudly about those slides with the additional money that we've done. That's where the money's going. We're putting it back into services. The wider plan is of such significance that we would absolutely need some form of corporate partnership to go through that in terms of that amount of building work and that amount of private. And at the moment, that's the debate that we're having with the Treasury. How do you have that partnership without it looking like another PFI, without it looking like you're mortgaging the future of the services? And that's a serious debate, so we haven't pushed on. The question about Alliance Medical, that is a subcontracted relationship, so we asked them to provide physical MRIs and the staff to run those. That contract comes to an end in February, and we start to do it ourselves. And then when we move the MRIs into the new building, that will all be run by West Middlesex ourselves. And again, the theory behind that is partly what I said earlier. We want to take responsibility on the site for all the services that we can. And secondly, we want to grow and develop our own skilled staff on the site. We really went to a Brentford Community Hub event on apprenticeships, and a lot of interest from local students about a career that happened to be about radiography. I had absolutely no idea what a radiographer did when I was 16, 17, 18, and I don't suppose these kids did either. But the actual idea of doing something scientific, technical, working with machinery, working alongside this, that excited them. And the idea that we could have got this great pool of local staff who can come into these new services is something that we're really excited about. There was a middle question there somewhere, I might not have got it.
No, that was absolutely it, thank you.
Yeah, okay.
Thank you. And thank you, Steve. Steve is a volunteer at the hospital.
Oh,
so
well, I should thank you in that case.
So we have technically come to the end of the time for this period, and I'm going to extend it a bit, but I don't want to do it too much because that eats into the time for the open forum. So could you raise your hand if you've got a question? Just see how many we've got. Got 1, 2, 3, and I know one from Reece. We'll take all 3 questions. If we start with Andrew, we'll take all 3 and then try and respond to all 3.
Great, thanks, Dan. Yeah, just to bring up 2 issues which I think are really important for residents of the Ham, which is, if you don't know the Ham, just kind of down the road here. The first one is to do with some unauthorised building works that's happening.
Andrew, can I just stop you? We will take that question.
Ah, sorry.
No problem. That question is better suited in the open forum.
Ah, got you.
So
Apologies.
No problem.
I will hold my fire.
We'll come back to you on that. So it was, yeah, so we've got...
Sorry, I just want to check a question, because she's asked me what doctors Andy goes to, and I just need to check. Andy.
Yep.
You talk about... Right. You talk about the pharmacists in the surgery, right? I'm very concerned. What about the pharmacists in the chemist in the high street? They are very important, the chemists in the high street. And you don't have to make an appointment. You can go in, you can get your prescription, and if you've got anything you think is wrong, they will tell you. So I do hope this is not in your idea with all your apps and patches to get rid of the local chemist.
I can absolutely assure you that local pharmacists, from the head lady at Morrison's, is coming to me on a Friday to have training to get increased So we're absolutely working together. We have absolutely every intention. We need to work together. So they're working with us on the inequalities work for blood pressure. They're working together with flu vaccines. They've worked so much with the COVID vaccines. There is more than enough work, and pharmacists, so absolutely not. And actually it is good, as Mark was saying, that it is now being overseen by the same body that oversees us. So I can absolutely assure you they're going to stay open till 10 o'clock at night, and the access is going to, we have really valued them more than before, I think, courtesy of COVID.
Brilliant, thank you. And was there one more? This gentleman here.
Thanks. Can we have some more defibrillators? Last Saturday I had a heart attack and I was very lucky. The person next to me is a nurse and she knew what to do. If she wasn't there, I wouldn't be here tonight. The other thing is we need more doctors. That's the basics, isn't it? It's no good beating around the bush. How's those going to do this? How's those going to do that? It's not. So what we need to do is encourage youngsters to go into the medical profession. So why can't we, as a local council, as a local authority, say to the best that we've got in schools, look, have you considered going into a medical profession? I've got a granddaughter who is doing, well, she's at Edinburgh University Medical School. And she started by just following an anaesthetist. And she shadowed her for 6 months. And then they said, would you like to, and she went on from there. But it's long-term plans we need, not stopgaps, get this on the internet, get that on your app on your phone. That's not going to do it. Yeah, we've got to put things in place.
Everyone would agree. We just got one more question. Before we come back to that, just was one more question here, then one from Councillor Williams, and we'll answer them all together if we can. Defibrillators.
You mentioned that the number of GPs were going down, which I think is obvious to all of us. But I mean, what plans are there in place to actually increase that, particularly locally? I know it's a national problem, but what can we do locally?
Brilliant, great question. And then Councillor Williams.
Actually, I think the last gentleman actually pretty much nailed my question. I mean, I think we're all very much aware, and it's certainly the big talking point that comes up a lot, particularly with all the changes in Brentford, is where are all the other services for this, and it's quite frustrating because if Wishing made it so, we'd love to just make more GPs appear, but we don't control it as a council. It's the people here who control that, and I guess I'd like to understand, because I think I've seen data that suggests that we are, in terms of people per GP, one of the worst in the country in terms of having not enough. And I think it would be helpful to understand what are the impediments, what are the challenges, and what can be done, because we've got space for more GPs, and there's plenty of space in Brentford to put additional surgeries. I'd just love to, I think it'd be very helpful to understand what the context is.
Okay, I'll start. It is, medical students don't, there's lots of people who want to apply to medical school, and the problem is the places at medical school. It costs £250,000 per medical school place. So the government has increased the number of medical student places, finally, but actually I would say the major problem is that GPs are retiring earlier. So I've just had 2 people in Brentford Health Centre retire before 60 in the last, just before 60, but 60, not 67. And so I think we have, retirement is one problem, GPs leaving, they work either part-time or they work, or they go abroad. So we have a massive retention problem. So, so those are our problems, and if you're going to, earn the same amount, you are better off living in, Cambridge or Dorset or somewhere rather than Hounslow. So the solution to that, from my perspective, is actually in the shorter term than the government, which I'm totally behind getting more doctor places and encouraging the next generation, but that is a long time in the distance, is I think using the workforce which is on our doorstep, which comes from around the world, There are doctors who are trained up around the world who come in who can't work because they haven't got qualifications which are seen, but we can train these people up. I actually saw a guy who said, "You saw me when I was a healthcare assistant, a doctor from abroad, we can accelerate up through stages of education," and he is now a doctor working in it. So doing work in the hubs. So I think both for nurses, nursing associates, healthcare assistants, I think the selling point here, what we are really trying is and the council is trying, is to use the people who we have coming from the world and allowing them to use their skills and experience and giving them the training, English speaking, computers, etc. But any ideas are welcome to be received, because I could do with another 10 doctors in our 60,000 patients, which is what's in Brentford and Isleworth. So if you have any ideas, I would be very open to them.
I don't have anything else to
Okay.
Dominic, please.
I mean, it's a thought, really. I mean, we're continually looking at the sort of balance between the demand that we have to support and the standards we have to support and our staffing levels. And I think we just need to be honest with the people, the population, the patients that we serve, that part of the answer, given the length of time it takes to go through training and the length of time it takes to go through the medical education process, that in the short to medium term we will be developing new roles for people. You mentioned nurse associates, we talked about prescribing physicians associates. There are a number of roles that we're looking to develop and to train up. And we just need to be honest with everyone that that's part of our solution, that there'll be protocols that will be developed about what's safe and what's sensible to be seen by what levels of staff. But we're going to have to, again, I think we just need to be clear with everyone what we're approaching. Increasingly, people are doing scoping under clinical nurse practitioners or nurse specialists. And to answer your question, we're consciously looking at these plans right now to try and balance up. So some of the MRIs, it'll be a consultant supervised service perhaps rather than a consultant delivered service. Otherwise we won't be able to run all 3 MRIs.
Go on, Mel. Very quickly.
It will be very quickly. Yeah. Dr. Chalmers-Watson, you said you were looking for ideas as to how we could get younger people. When I attended health AGMs, when I was a counsellor and whatever, I always raised the point of, why are you not going into schools in their careers years? And I always got the answer back, well, we haven't got the resources or facilities to be able to do that. Well, if not, why not? That's if you really want to encourage people, that is the time when you should be starting to encourage them.
We've got one final question from Debbie, and this is the
It's just an answer to Mel being a teacher. There are children that are desperate to get into medical school. There were 20 children in one class at the Green School last year that wanted to go into medicine. None of them got a place. The children are there.
Thank you, Debbie.
It's the places that are lacking. Yeah, the children want to do it. Even at the age of 10 and 11, I teach year 6s. I've got 8 children out of my 30 at the moment who want to be doctors.
Wonder how many of them will be. Thank you. So we're going to close this. Oh yeah, we didn't get the comments on defibrillators. Do you think we need more defibrillators?
Defibrillator in the health centre, definitely. Yes, on the wall behind the reception. So, Park Run has 2. I think the number of defibrillators appears to be going up significantly. But we've had defibrillators in health centres since I was working at Argyle. It was in all of them. So 15 years, every single.
People don't know that they're out there. That gentleman just said it saved his life. Stick one on the wall outside Morrison's. Sorry. You don't need to. It tells you. It's idiot. Yeah, it's idiot.
As we descend into this chaos of fighting, I'm going to bring this to a close because we have gone over. So I'd really like to thank our 3 guests for coming. That's so appreciated. You are incredibly welcome to stay for the rest of the meeting, but if you choose to slip away, I would understand. But thank you very much for coming. There you go. Head back to your wife, Dominic. Yeah, thanks again. So next up, we have agenda item 4, which is a presentation on the community and family hubs launching in Brentford in 2024. So I'd like to invite Ben, Claire, I think Mohammed, you can go there. You can sit there so you can do the slides. This drastically puts the pressure on Mark and Dominic and Julia to slip away. We're going to have it seamlessly. You go there. I find if you start talking, they shut up at the back.
Good evening, everybody. So it's great to be here. My name's Claire Parker, and I'm Head of Community Solutions. This is Ben Fowler, who is a user researcher at Hounslow Council, and this is Mohammed Ahmed, who is the project manager, for Family Hubs. So we're here this evening to talk to you about the family and community hubs. I will be as brief as possible with the formal presentation. We just want to give you a quick overview of the plans around the community and family hubs. And then we want to open it up for a discussion. So there's an opportunity for members of the audience to ask any questions they might have, but also we have some questions for you because we really want to get as much insight as possible from local residents about family and community hubs. So I'm not going to lie to you, I quite like doing things online. Certain things I love doing online. I like to click on my phone and get an Uber Eats on a Friday night. I quite like to reserve a library book online. But I don't want to do everything online. I absolutely don't. Maybe my elderly mother has got sight loss and I want to talk to somebody and understand what options I have to support her. Maybe I have got into credit card debt and I'm worried about where I can go with that now and what support I can get. Maybe I have been out of work for some time and my CV is out of date and I could really do with some support to get back into work. And at those times, I want some support face-to-face. I want to talk to a human being, I want some empathy, I want to make eye contact with somebody, or I want somebody to listen to me and understand what I'm saying and to really help me out. So this is not about going back to face-to-face with all of our services, but it's about finding that balance so that we provide face-to-face services, in-person services in local areas where that is appropriate, so that people who need those services can get them, and in their local area, so they don't have to go halfway across the borough on the 235 to get to a local service, so that there is something here in Brentford that can help people. And it's not just about council services, it's about providing a range of services, so it's working with our partners. So, for example, it might be working with the RNIB, it might be working with each counselling and support, it might be working with our community safety team in-house. It might be about working with the police and the Safer Neighbourhoods teams. It's about making sure that we have all of those services available in the local area and people can access them really easily. So when we're setting up these hubs, which is something that we want to do at the moment, we're making sure that we're making better use of our council venues. So the council has got more than 100 venues right across the borough in all kinds of different uses. So we've got leisure centres, we've got libraries, we've got community halls, all kinds of things. And it's probably fair to say that not all of those buildings are in use all of the time. And we know that we can use our existing buildings and our existing council officers and our partners to bring those services closer to people so that they can access them. So the community hubs are designed to be for everyone, absolutely anybody in Hounslow who has a need to see or speak to a council service, we want to make sure that can happen. And the family hubs are for families with children under the age of 19 or up to 25 where the child or children have additional needs. I'm going to hand over now to Mohammed, who's going to talk a bit more about the family hubs because they're already up and running in Brentford. And then we're going to move back and talk a bit more in detail about the community hub because that's something that's coming in the future.
Good evening, everyone. My name is Mohammed, and I'm the Family Hubs Project Manager for the London Borough of Hounslow. Oh, sorry. Is that better? Yeah. Okay, so last year, the government launched the Family Hubs program, and 75 local authorities, including Hounslow, were selected to take the program forward. Essentially, what the government wants to see is in these 75 local authorities, these family hubs, essentially a one-stop shop for families with children aged 0 to 19 or up to 25 with SEND. It's a place, a physical place, essentially where families can go and get information, advice, and support on a range of issues. There's a particular focus on early help and prevention. The aim is that if we can support families earlier on, then there's a less likelihood of the issues and challenges that they face, these issues kind of escalating to the point where statutory intervention or specialist intervention would be required. And we know when it gets to that point, sometimes it's quite late, but a lot of the times it's quite costly and can be quite detrimental to the families. As part of that program, the government have outlined a whole range of services that must be delivered as part of the family hubs, and we've listed that in that slide. But core to this family hub offer is focusing on the 0 to 5 age range. So thinking about services such as parenting support, infant feeding, early language in the home learning environment, and perinatal mental health. Oops, sorry, am I going back? Okay. In June, we launched 3 hubs, one in the west at Alf King Centre, one in central at Lambton Centre, and one in the east at Brentford Centre. So those are the 3 family hubs, and along with those 3 hubs, we have the existing children's centres, and we've also created what we're calling 2 access points, one at Feltham Library and one at Hounslow House. For the Brentford Family Hub, this is what we have going at the moment, different sessions, programs for families, and our plan is over the next months, and by the end of the project, which is end of March 2025, we'll have a whole range of issues, a whole range of programs and support mechanisms for families going across the whole 0 to 19 or 25 with SEND age range. Back to you, Claire.
So we launched the first community hub in Hounslow in Feltham. We had a soft launch in June, and we've been testing and trying out some different services down in Feltham Assembly Hall for about 3 months now. And we had a fuller launch of the full service last week. It's been really exciting to be involved in that project. We've got between 12 and 16 services regularly on site at Feltham Assembly Hall. We offer all kinds of different things. So we've got community safety advice, we've got benefits, we've got the community support team. There are lots of different council teams and other organisations who are on there helping people regularly every week. In order to put that service offer together, we did some community engagement. So we had lots of workshops with the community. We have a residents focus group, and it's very much built on data and insight so that we know that what we're offering is hopefully what people want. And we're going to continue to build on that insight so that we understand that, what it is that people are saying locally to us about what they want to be able to do at the community hub. And the thing that hopefully is quite exciting for you is that we are now looking at the plans for what we can do in Brentford to open a community hub right here in Brentford town. So over the next few weeks, we're going to be looking at what sorts of services and activities we're going to be offering at the community hub. And we're also going to be looking at where we might offer it. So as I already mentioned, we have a number of council buildings across the borough, so we're scoping that out. So for example, we might look at, could we use the library on certain days of the week? Could we use the digital dock, for example, there's clay ponds, there's Mission Hall, there's all sorts of different buildings. So we're going to go through a process now of scoping those out, seeing what's available to us, seeing what we could offer in different locations. I should say I don't have all of the answers. We're right at the beginning of the process now, and that's really why we wanted to come and talk to you this evening, because we want to get that discussion going. So I think next it would be great if I could take any of your questions that you might have specifically around the community hub, and then we could open it up to a discussion, hopefully, with residents.
Okay, any questions firstly? Okay, Julie was first. Super hands speeding up.
Hi, I've got a few points here. A, life don't stop at 25. We have a lot of families that have children over 25 that need help and support. But you're looking at the younger ages, which there is a lot of support, but what about the families that may have mental health or learning that need support over 25? It seems, oh, let's forget them. You might as well get your pension at 25 now. The other thing is, why Brentford High Street again? You've got community centres. Yet again, it's Brentford. Clay Ponds is forgotten. We're organising our own stuff for hubs. But yet again, there's nothing. It's as though anyone who lives over the Great West Road, we need a passport to come over here, because Hounslow Council will take our council tax, they will take our rent, but don't worry, I won't swear, but they don't want to know the rest of us. We go over there and do our own. But all you keep talking about is you've stopped Brentford High Street, this place. Why isn't anything being done for the council estates? Because there's a lot of people live on them and we are being forgotten.
Chair, if I may. Thank you. So, Julie, thank you for your questions. Just to clear that up, and perhaps I didn't explain very well. So, the DFE funds the Family Hubs programme, and that goes up to to support families up to the age of 25, where there are children with additional needs. But the community hubs, and this is why we have this wraparound offer, the community hubs are there to support absolutely everybody in the community. I can't guarantee that we can provide absolutely every single service, but the idea is that we do provide that joined up offer. So that's why we have family hubs and community hubs working hand in hand, so that we can make sure that we've got a much better transition process for children when they get to that age. And we also do have additional health services provided at the community hub. So the one that I already mentioned, it's down in Feltham. We have the health outreach team there. We have various mental health teams. So if you've got any specific suggestions around how we can enhance that offer for people with additional needs when they're past 25, then we can certainly look at that. In terms of Brentford Town, I'm sorry, I did mention clay ponds. We haven't ruled anything out at all. We're at an options appraisal stage. So over the next few weeks, we will be looking at lots and lots of different buildings in Brentford, and I don't necessarily mean Brentford High Street, I mean Brentford in terms of the wider Brentford town. And we want to make sure that it's something that's accessible. So we will consider things like, is it a location that's easy for a lot of people to get to? Does it have good transport links? Are we able to open it on different days of the week or different times of the day so that it's as convenient as possible to as many people as possible? Also, I think it's really important to mention that it will more than likely be what we've described as a campus approach or a network approach. So it won't just be one building, it will be several different buildings. And part of what we want to do is make sure that we join up all of those fantastic activities and offers that are already there in the community. So if we have different community organisations, Julie, I know you're very active obviously down at Clay Ponds, we have different community organisations offering different things in different locations. We want to make that part of the overall offer so that we help people to find out what is available in their local area and promote it and make that accessible to people.
Thank you. We've got one more question. We're already 6 minutes over for this session. I know you actually wanted to get some feedback as well as questions. So just last question from Sharon, then if we can quickly do the...
Hi, I just wanted to give some sort of positive thing towards this. My daughter lives in the Midlands. She's lived there about 6 years, and since she's lived there, they've had one of these. It's basically the library, but it's probably double the size of this building. It's open 7 days a week. It's for people from 0 age to 90. So all the elderly, the young, everyone goes there, and it has all the benefit information, the library, all the under 5 sessions, all the elderly sessions. It's all in one building. So I think it's a really good idea, and we're a bit behind the rest of the country, but it does work well and would be really good. But I think you also need to think it can also be for all ages, not just for families.
Brilliant. Thank you, Sharon.
Thank you. That's really good to get that insight. I'm going to hand over to Ben Fowler now, who's our user designer, so that he can throw over some questions to you so that you can come back with your thoughts. I'd just like to say as well, we will have a resident focus group. So if anybody has sort of burning desire to be involved in that, if you have any other feedback at all, please do get in touch with us and we can take that away if we aren't able to get to it in this session now. Thank you.
Thanks, Claire, and hi everyone. So my name's Ben, and my role is essentially listening to residents, like normally like one-on-one or in a focus group or something, so it's a bit different like this, but I thought it'd be good to get a conversation going, because as has been pointed out by Claire and the resident there, like this, it's not a new idea. These already exist in other places, but it can be flexible. So we can bring in different services. Like the council does lots of different things, right? And we could, in theory, bring any kind of service, and we can work with partners as well. So, but we want to make it kind of relevant and appropriate and kind of fitting for the local area. So we're really good to get some ideas going, and around services or activities that you would like to see in a local community hub. So and there's other questions on the board there as well. So what kind of service activities would you like, and also about like what do you want their kind of hub to look and feel like, the kind of space, and like what do you want it to be like? How should we inform residents as well? If you want to be involved in the hub as well, it'd be good to get your thoughts on that. So
Ben, are you asking for live answers to these questions now?
Yeah, well, yes, and I'm also going to be coming back to the area, to going around different parts of Brentford, speaking to residents as well. So there'll be other opportunities to submit ideas, but it'd be good to get any answers to these questions now as well.
So if anyone's got any thoughts, what services or activities do you want at the Brentford Community Hub? What do you want the hub to look and feel like? How do you want to be kept informed about what's happening? I guess some people don't want an update on an app. And do you want to be more involved with the hub? Someone there? I can't see.
I think it really useful to have teaching English as a second language as one of the opportunities, because I have a number of friends who are actually quite impeded. They don't get the opportunity, and often they're working really long hours, so it almost needs to have a flexible opportunity for classes.
Thank you, Carol. Anyone else?
Can I just ask out of interest, does anyone here access any council services at all? So whether it's speaking to ward improvement, traffic, highways, it could be ASB, it could be public health. What services at the moment are you contacting the council about at all? Parking? Do you never speak to your local council about stuff?
Debbie and Sharon are laughing because they call parking every day and me every other day.
You'll hear about it later, but we're on the ham, so we've had a lot of input with traffic, highways, parking, traffic enforcement, planning, all that sort of thing. Yeah.
So when you access
local councillor.
Yeah, all right. Local councillor. Who's that? The local councillor?
I must say we are really lucky. We have the best supportive local councillor ever. He might correct.
You go through your local councillor, but do you contact the council directly? So when you speak to parking, do you phone them up? So parking is one, and then are there any others that you think actually it might be quite useful that instead of having to try and phone them up and leave a message and get someone to phone me back, wouldn't it be useful to know that, say on a Tuesday afternoon, you could go along to Brentford Library and people from parking services would be there, so you can just go and speak to them face to face without thinking I'm going to have to phone them up.
Excuse me, have you ever tried communicating with these people?
Are you talking about the councillors?
These are the people that held a borough-wide survey to see if we wanted LTNs. Got the result, everybody against it, they ignored it and went ahead. What's the use of contacting them? If they're going to ignore what people want.
This question would be better raised in the open forum, not shutting it down. Well, I'm trying to be polite. Yeah. Yeah. So the questions for this section are: what services or activities do you want at the community hub? What do you want it to look and feel like? How do you want to be kept informed about what's happening? Do you want to be more involved with the hub? Anyone who'd feedback on that? Philip, go for it.
Hi. I think I saw on a previous slide something about SEND for children. So do you think something the community centre could do would be speech and language therapy for kids, something like that? Because the waiting list is obscene, absolutely obscene. So if something like that could be done there, that would be amazing.
So just quickly on that, that is falls within the remit of family hubs, and that's something we're looking at. We know there's an incredible long wait to see or get a statement, so we're looking at what we can provide for families in the interim, whether that's seeing a professional or something that parents, like toolkits, etc., parents can do at home. But that's definitely something on our agenda.
Maria, go ahead.
This was basically the same question which I have. I know a lot of parents who are waiting for AHCP plans. They're not coming through. They don't see an educational psychologist. They don't get referrals to CAMS. So I think this is really, really important in this borough. And schools are struggling because they don't get the funding until the AHCP plans are there. So we need something where we can support these parents and then support the schools at the same time.
Thank you. Anyone? Oh, did you?
No, I was just going to say that I can see that there's obviously, some interest in finding out some more information specifically around the send offer at the family hub. So I think that's something that we can commit to coming back on with some more detail around that send offer, because I know that obviously it's a cause for concern. It's something that's a really important topic.
Thank you. Any other inputs on the 4 questions on the screen? Yes, the gentleman over here, check shirt.
Hi, thank you. This is sort of to inform location. And Ben, to be perfectly honest, you drop a question like that, no one's going to come up with a decent answer. But cooking's a really good thing to get families involved, meal planning, particularly on a budget. But that might inform where you want to site these hubs. On the other hand, use libraries, love libraries, keep them going. Don't want to lose our Carnegie one. So that's basically it. It sounds great as well, by the way.
Thank you. We are over the time for this session, but Emily, if you want to really quickly come in.
Just to say in Feltham, as you said about cooking there, one of the things that they've done really well is they've had local groups come in and run taster sessions or small sessions. So we've had sewing sessions, we've had sports for younger people, cooking was a consideration, exercise classes. So these are some of the thoughts as well for future when they come back round. Think about the other aspects that you might want.
Brilliant. Thank you. How can the guys contact you if anyone have any further thoughts, or anyone watching this online, as I know people do in their millions?
People are very welcome to email me, personally, claire.parker@hounslow.gov.uk.
How do you spell Claire?
With all the vowels, CLAIRE.
The proper way.
Yeah.
Well, guys, thank you so much for coming. Really great to hear, and let's show our appreciation. You're very welcome to stay for the open forum. I completely understand if you don't. Okay, so moving on to the next section, agenda number 5, which is the open forum. Opportunity for members of the public to address the meeting on general issues relating to the agenda and issues not on the agenda. Please know that individual cases cannot be discussed. I wonder if we'll have any questions for this section. First up straight away was Julie.
Yeah, I think everyone's going to be on this one, is Ealing Road. I tell you what, Transport for London had put low emission zones. The emissions out on the Ealing Road and Great West Road, that roundabout, must be horrendous. It must be higher than anywhere in the country. But the thing is, why, after I've lived here 40, 50 years, has it been changed? And I think it's a danger to people, it's a danger to motorists now.
This won't surprise you, you're not the first person to have raised this. But yeah, so Catherine, did you want to come in on this?
Yeah, thanks.
I'll give you an example. To come down South Ealing Road, from the cemetery to Chestnut Avenue will take 15 minutes to half an hour. Now that's not good on anyone's economy, a petrol or...
Yeah, we're all aware, totally aware of the problems. Let Catherine answer.
Sure, yeah, so I appreciate that, and as Dan said, you're certainly not the first person to raise it. I mean, there are multiple issues because there are several sets of roadworks and things going on in the area, but certainly the change of the traffic lights, the new traffic lights and the new sequence at the corner of the junction of Ealing Road and Great West Road is causing those delays and causing some problems. So it's TfL, Transport for London Road and traffic lights, traffic signals. So they upgraded those signals. Basically, the previous signals came to the end of their lifetime, so they had to be changed. And at that point where they changed them, for the new equipment, TfL looked at, well, they were already aware that the signal pattern that was in place did not meet modern requirements from Department of Transport, so it didn't meet those standards. I believe, well, I know because I was here, that in 2015 there was a proposal by TfL to upgrade that junction and to put in not only that sequence but actually redo the junction as well, and put in sort of things going through the middle of it. That was rejected by Hounslow Council Transport team with the support of the Isleworth and Brentford Area Forum at that time. So the proposal was dropped. However, with the equipment coming to the end of its useful life, it had to be replaced. With it being replaced with the new equipment they have in place, if they put in the old sequence of lights, then it would basically switch off because it would automatically say, right, this isn't compliant with standards. This is the story from TfL. This is what I'm relaying. We obviously are aware that this has caused problems. Certainly Councillor Lambert, who's not here tonight, has been dealing with this, as have other councillors at this table. And obviously as lead member for transport, I have as well. So my team, the transport team, are now talking to TfL about some of those additional aspects that were in the original plans that came to the Area Forum years ago. Could we look at those? They were rejected at the time. However, given how bad things are now, I think everyone's thinking, well, it can't be any worse. So let's look at them again and see if there's anything we can improve.
Gentleman here.
Yeah, just following on from that on Ealing Road is the Windmill Road saga. The junction completely closed off. Now, why that had to happen, because that first pillar on the A4 was actually done when they were there the last time round. Surely if that one was done, they could have terminated the barriers and left Windmill Road open for people to come across. That makes the situation twice as bad, and like Ealing Road, the traffic is queued up all the way up Windmill Road. And if, as the council believes this is a problem, I think the council should have somebody there every day, every hour of the day, monitoring the traffic on all those roads and feeding it back to TfL on a regular basis. It's an absolute disaster. Anybody from Hounslow Council talking about environmentally friendly and allowing that to happen, it's just not right at all.
So thanks. So we are feeding back to Transport for London, also National Highways, because it's National Highways who are doing the work on the M4 pillars, which is contributing to the current situation. We are feeding that back. Your councillors have been working very hard on your behalf, and you know, Guy emails me every day pretty much about it, and others.
Well, I have to say, I understand you're working, but you're not being very successful.
Well, because it's not our area of control, but as I said, those discussions are
it's destroying the
ongoing.
whole of the traffic in the area.
Yeah,
We'll come back to you if there's time, but I just want to let at least everyone get one question before we give you more.
Sorry, just to add to that, if there is anything that we can do in addition, then we're committed to doing that as well. So we are looking at that. But I agree, it's not a very satisfactory situation.
One of the things you could do is remove the
Just hold it. Yeah. Okay. We just want to let everyone, at least everyone, have one question before we go. You're fine. Yes, it's Andrew here.
Great, thank you. Sorry about earlier, my first appearance at the forum, so not conscious of the protocol, but hopefully whetted everyone's appetite. So two quick things. One, firstly, just to make the councillors aware about some unauthorised building works going on at 1 to 2 The Arches, the Ham, which I think really would be of concern to anyone who cares about Brentford's Victorian heritage, and I think needs some real scrutiny, and is causing real concern to the residents, not just of Balderston Court, but the Shire and elsewhere, where we're literally seeing unauthorised building works, extensions, damage to the Victorian archway. And I think the concern is, what do we do when developers just play fast and loose with planning regulations, ignore them, etc. And I'm really conscious, of the terrible events that happened in Staffordshire with the Crooked House pub, where people literally woke up one day to find, this important piece of heritage knocked down. And how do we respond to developers who just kind of ignore, ignore rules and regulations? There's also concerns around the environmental impact to residents and air pollution as well. So please, it'd be good to engage with the councillors on this, and anyone locally who wants to know more about the issue, please come and speak to me. The other one, sorry, is just around traffic again. Just if anyone can throw a bit of light onto what's happening in the Ham with the temporary traffic lights, which seem really confusing and seem to be changing on a daily basis. I'm sure there is a master plan somewhere. If someone could tell me where that is, I will love to look at it. Thank you.
Thank you, Andrew. Yeah, so I'm aware of the issues at 1 to 2 The Arches, and enforcement did step in and stop what they're doing. They've since put in a retrospective planning application, which I believe you're aware of. That's sitting with planning at the moment. I've made my thoughts known to them about, there's a whole plethora of issues around that. The big challenge there, as you know, is some issues, for instance, boundary disputes can't be considered part of the planning process. So there are some huge issues, but I am aware of it. I'm dealing with Jason from Notting Hill Housing Trust, who's responsible for the site. On the question of the Ham and traffic on the Ham, I think there is a lot going. I don't want to say, yep, it's all fine, there's no problems, because everyone knows there are issues there. What I can say is we're working really, really hard on it. There were supposed to be traffic lights put in by the time the Morrisons opened. That didn't happen. There were then temporary traffic lights. There were then issues with those temporary traffic lights, from the phasing to the location of them. There was also a problem that the car parking bays next to the temporary traffic lights meant that the cars queuing to get out of the Ham were queuing on the wrong side of the road, so people couldn't get into the Ham. I was down there this morning with Councillor Dunn, with Councillor Bruce, who's the lead member of development, with the head of planning, head of traffic, senior person from highways. So we are working really hard at finding a short-term solution, but also a long-term solution, one of which is to the problems in the footpath. And obviously, historically, when that's been a really quiet road, a lot of the residents would just walk down the road because of the state of the footpath. We know that there's disabled residents, residents with buggies. Now, obviously, they can't. So we're working really hard, and I promise you, I have been working on this for quite a while, at a short-term and a long-term solution to it. But please get in touch with me if you want any further clarification on that. Debbie.
Following up for the thing about the ham, I would like to publicly say Dan has been totally supportive of all the residents down on the ham. He has been brilliant. Nearly ran me over the other night on his bike because he was coming through the ham as I was trying to negotiate my way. Can I throw something out there? Councillor Dunn, the traffic lights are causing as much problem now towards Green School as you've got up that end. It just seems everything's bottlenecked. You're constantly queuing back to the Green School now to get through Brentford. Road rage is happening because people are diving up the bus lane by Pets R Us to undercut all the traffic. Can I throw something out there? Totally ridiculous. Take the traffic lights away. Go back to everybody just has to come out of the ham and treat it as a junction. It worked before. If there's not supposed to be that much traffic coming out of Morrison's, which we've all been told, the lights were not working this morning. So I dawdled up to the T-junction, looked both ways, thought, oh, there's a gap, out I went. Take the lights out. It can't be any worse than what it is now. Put in a keep clear, put in a yellow box junction, give it back to the residents to say, okay, treat it sensibly. We've been having to wait for 3 changes of lights now to get out past the parked cars, and it's just chaos there. Take the lights out, see what happens. If it doesn't work, then let's go back and try and sort something out. And can I plead any cyclists, I nearly had one of you Saturday morning, lights were green, off I went, and all of a sudden, I don't know why, I stopped and I nearly had a cyclist on my bonnet who was very surprised to see me coming out on a green light when he was going like a bat to get up over the bridge to Brentford Bridge. There is going to be an accident.
Thank you, Debbie.
Take the lights out, let's see what happens.
Catherine, what are your thoughts?
Well, I'll certainly pass that suggestion back to the traffic team. I mean, obviously they will need to look at that, you know. I mean, they are going to look at options. Yeah, good. So, you know, I can throw that in there in the mix, but they will obviously need to do a safety assessment on anything that they think to do.
Permanently sat in a car monitoring it all, and they totally agree it's chaos. Why have we got lights there? So please take the lights out. If it doesn't work, then we can.
Thanks, Debbie. We will feed that back. Gentleman here.
It's for Councillor Dunn. Just 2 quick questions. Firstly, at the last meeting, I asked if I could see the memorandum of understanding between the council and Lime Bikes. You didn't give me that, so I put in a Freedom of Information request twice. It hasn't been answered. The second question is, are you aware that a criminal act was committed by Lime Bikes in Hammersmith and Fulham? Where in Hammersmith and Fulham, if a Lime Bike is found on a pavement or a road, it is taken to the pound. Lime Bikes broke into the pound to get their bikes back. The police have been called and it's being dealt with now through the courts. Are these the type of people that we should be doing business with?
Thanks. So the first one obviously wasn't a question. The second one, yes, I'm aware of the incident. I probably read the same report that you did in the local press. So it wasn't Lime that broke in, it was a contractor of Lime, and they have now terminated because they, you know, Lime are not happy with that behaviour either.
So if I have a gun and somebody else pulls the trigger, I'm not responsible, I see. I mean, it's criminality.
So just let this gentleman come in. Over here. Just wait for the microphone if you can.
Sorry, just going back to the Morrison scenario, you as a council knew there was going to be a supermarket built there all this time, and yet here we have it opened and nobody's even planned how the bloody hell people are going to get in and out. No traffic lights, no organisation. How did that come about?
Sure, so yeah, so this was part of the, as you know, the wider Ballymore development, and officers looked at the the idea there'd be a supermarket there, and put in a lot of stringent things that would have to take place, one of which was having traffic lights. Now, there were a number of delays in the reasons for the traffic lights. Ballymore have given a number of delays. One of the ones they said is, TfL were taking too long to grant them. I'm not that interested in getting to the bottom of the reason for the delays, but what happened was we realised there were no traffic lights. And so Councillor Tom Bruce, who's the lead member of development, he took legal opinion. There was a lot of different options we could have taken, but we worked with Ballymore, and they got those temporary lights in just in time. So,
is that where the traffic's going to come out permanently? I expected to come back up the tunnel, turn right, and out into the high street.
That's so via the.
That's where I thought you were talking about traffic lights being.
So the planning agreement in 2015, I believe it was, stipulated that the traffic from Morrison's, apart from the articulated lorries which can't go under the bridge, will exit 2014, being whispered on here, many years ago. When the original planning permission was granted, it was stipulated that the traffic would exit via the Ham from Morrison's car.
But that's a chaotic junction, traffic coming out on the bridge. Absolutely chaotic.
Well,
designed by idiots.
I can tell you that officers from traffic, highways and planning are looking at that situation in great detail at the moment. Jim Storer.
Thanks. Thank you, Dan. It's just a general point for us, which following on from the gentleman here, I think in terms of conducting the forum, I think that a regular, there should be on every agenda what you might like to call a rolling action list. For example, Bob's question about the memorandum of understanding with Lyme, that would have appeared on the action list last time round, and there'd be a follow-up. And I've got a similar one. At the last forum, the last meeting of this forum, I think it was John Dale raised a very important question which related to an internal inquiry that has been conducted at Hounslow into the conduct of councillors, including members of the planning committee, at a meeting on the 4th of May this year. Now, we understood there would be some more information on the results of that inquiry, and we don't yet know what they are. Are they available?
I can just pick up on the...
Shazna, I would really love you to answer the action plan, because we've been working on that, but just let Catherine answer that second question.
So I think what I said was if we could provide more information, we would. I've not been able to provide any more information about that inquiry. I know some people have put in FOI requests that have been refused on certain grounds, and that's all I can say.
Sorry, Shazna.
Yep, just to respond to the question about the action plan, we actually are going to be putting one together for the Brentford and Syon area forum. So we, Bill, our clerk, is taking a note of all of the questions and the things that we need to update residents on. And then that's going to be, we're going to take that back, and we're going to put a list together and then allocate them to the responsible officers or the responsible teams within the council as appropriate, councillors as well, and then we're going to follow that through. And then the idea is either at the next area forum, or even if we get a response before then, we can always get back to a particular resident who's raised an issue and then give you those responses. So either back to the future area forum or to individual residents groups. But the idea is that those actions don't fall through the cracks, that they don't get forgotten about, and that you as residents coming along and spending 3 hours of your evening here coming through the rain, that there's going to be a resolution and an outcome for you being here, so that, you know, hopefully you'll come along next time because you think, actually, we raised a point, you know, it got dealt with, we got a response, even if it's not the response that you want, at least you'll get an explanation as to why we weren't able to do certain things, or if things have been completed, or if things, actually it's going to take a lot longer than we originally thought it was going to take, but we're still working on it, we haven't forgotten about it. And so that's the plan.
Thank you, Shazna. Shazna is actually the brains behind the entire area forum. It's not councillors, it's Shazna. Right. Maria, did you have another question?
Just coming back quickly to Ealing Road and the A4. Did the council conduct a survey with the residents living in this area to help you support with the TfL? Did you ask schools to support you with that? Because I know a lot of children are late to the school because of the H91, for example. You have 3 huge schools on that road. So it's Isleworth and Syon, it's Nishcombe, and it's Boulder. The students are passed by the buses because they're already full. The students are late because the buses are not on time because of the huge queues. And it's, from my point of view, I can see it from the balcony, you have to also include first responders. An ambulance being stuck for 7 minutes, not being able to move and not getting to the call. So I think you need to ask first responders as well to give you their input on what's happening in this area.
Thanks. I mean, we haven't carried out any formal consultation because we don't have any proposals on the table at the moment. We have been, obviously, evidence that has been given to us, that's been forwarded to us via ward councillors or by people writing in directly, has all been sort of collated and used as part of those discussions with TfL, but very good point about particular groups of people that perhaps we could ask.
A rare question from John Dale.
Yes. I want to welcome Councillor Balraj Sawi here tonight. I think it's a year since he's actually been to one of these meetings. His performance generally as a councillor has left a lot to be desired. Does he want to say something to apologise for his poor record while receiving his councillor's allowance? And does he want to tell us what he's going to do to show that he's interested in serving the people of Syon and Brentford Lock?
I think I'm going to guess that's a question best answered by Councillor Sarai.
Thank you, Dan. Thank you, John. No, you're correct. My attendance has not been the best in the last year. Oh. Can you hear me now? Okay. Yes, you are correct. My attendance has not been the best in the last year, and I do apologise to all the residents for that. But the situation has been, when I first got elected, my company won a massive contract in Australia. And me being the team lead, I wouldn't say asked, I was kind of forced due to my contract to do extra hours. So I was doing 12, 13, 14-hour days covering both start and end day of Australia and the UK time. So that was my situation for the last year. I found a new job, which I have been actually 3 months today. So yeah, I mean, you have noticed, I can see by your post that my attendance is a lot more recently. If you check my casework, that has drastically improved as well. So yeah, I mean, I do apologise, but circumstances at that time, I couldn't really leave a full-time job. So yeah, I'll still be here, and if you have any issues you want to raise to me, just please let me know.
And just on that note, I can confirm in the last couple of months, I personally have seen a lot more of Councillor Sarai across, canvassing, casework, meetings, and it's been fantastic to see that, and I'm sure it's going to continue.
Giving back his
Just
allowances.
wait for the microphone a second.
Can we take it that the councillor will be giving back his allowances for the period of time where he couldn't do any council work? Perhaps give it to the people who are queuing up in food box queues, and can't pay their electric bills?
Yeah, no, he won't be giving back his council allowance. Thank you. Why'd you ask a question then? Anyone else? Is that a hand at the back or someone scratching their head? Another one from John Dale.
going to happen to it because it's, the Morrison site, the old Morrison's, is sitting empty, looks very vulnerable to some sort of caravans and motorhomes moving in. We've seen how the old police station very rapidly became derelict, attracted antisocial behaviour, lots of litter. How are we going to make sure that the Morrison site doesn't turn into something like that, and in a very prominent place in Brentford, much more than the police station?
Catherine?
You want to?
Hi, John. I think it's a very reasonable concern that you've raised. I don't disagree with you at all. We have seen in the past what happens on sites that have been vacated. I am very hopeful that the owner of the site will be taking steps to ensure it is properly secured, and I'm sure teams within Hounslow can have those conversations. I'm also very interested in ensuring we grasp the meanwhile opportunity that might be possible within that site, and that we actually find a way for that building to be put to good use while it is waiting to be developed as part of the plans that it has. So I definitely think that you're right to raise it, and I think we'd all like to see, one, it secured so that we don't have these problems in the future, and two, see some proposals from the developer. Again, we don't own these sites, and we can't necessarily compel anyone to do anything, but I'm sure we will convey very strongly what we want to see happen on these sites.
Thank you, Rhys. Julie's got another question.
Yeah, this is just a little bit of a notice. No word of a lie. Everyone, all the agencies that were out there have cleared off home. We're sitting here listening. Surely, not being horrible, some of those agencies from the council should be sitting in here listening to some of our views as well, because you've got to go back and report them back, but they've cleared up and gone home. Even the police have cleared up and gone home. We've not even had a report about what's going on with them tonight. And the other thing is, why aren't we having an update from Hounslow Housing about the developments that are going on in Brentford, the Albany development, the new buildings that are on Brentford High Street? We don't ever hear anything about what the tenants, the Hounslow Council tenants, and what Hounslow Housing is doing.
Rhys, do you want to take that?
Well, I could... Well, that last bit sounds like a suggestion for a future item at an area forum, so I'm sure that's been noted down. Sorry, I've forgotten what the first bit was about now. Marketplace. Oh, this market. Yes. So yes. Well, so the council staff were here for a good hour or so before the meeting started. So they were available then for you to talk to, for residents to talk to about any issues within those areas. If there are other things raised in this part of the meeting, then obviously we, as your representatives on the council, yes, we can feed that back to officers, but we're also here to take responsibility for it ourselves, because we run the council. So I think you've got the best of both worlds here. You've got councillors and you've got officers.
So, Julie, were you also making reference, when you were talking about external agencies, I got the impression you were referring to people like TfL and National Highways and people like that?
The old area forums used to have people sitting around the table, like TfL. You knew about what's going on with Ealing Road. Why aren't they here? Yes, we spent nearly an hour listening to the NHS. Brilliant, some of it's not. How many of us really want to know about what's going on at West Mid? Because you can't get an appointment there anyway most of the time. Well, the issues people want to talk about, we're not talking about it, and you want to hear our points of view, but we're just listening. When you're coming up, oh, well, let's have these here. We want to get the nitty-gritties. You want us to give stuff back to you. But if we're not getting the information, getting the people there...
Sorry, what's the issue that you think should be discussed?
Pardon?
What's the issue, the specific issue that you think should be discussed?
I think, normally you hear about what's going. I know we do the East and West area forum, but not everyone goes to that. It'd be good to have the police check up, because I probably know more about what goes on with the police. But they're not talking about things. You'll hear, you go up there. I was asked, why isn't Clayponds coming to these meetings? Can't you see why? It's pitch black, it's miles from anywhere. And no, we haven't got a decent bus route that runs here. People want to know what's going on, and as you keep saying, it's on apps and stuff like that. But if you haven't got a subject that is interesting, like at the moment, as I'm just using TfL, people aren't going to come. There's not as many people here tonight as what there was last time when it was on about line bikes. What you've got to be asking, why?
Thank you, Judy. Well, I'm really sorry that you didn't enjoy the contribution from West Mid and the other speakers. We did a poll on Facebook, got 600 responses. Health was a really key issue. It was the second most popular. And actually, to be honest with you, the other councillors, Shazna, worked really hard at getting some, I think, really high-quality people to comment on health. So I'm really sorry you didn't like that. Marina, you've got some comments regarding...
Please. Yeah, with regards to the police duty, when they split the ward, we now actually have a Brentford East police panel, don't we? Because it is held in Clayponds. We're due another one very shortly. We're just waiting on a date. Yeah, but the reason the police were in the marketplace is because we want the police out there catching the criminals, and so that's why for the first hour of the forum you can go to the police, you can speak to them. On the agenda you've got the records of what they've been doing since the last forum, but they stayed around for 15 minutes when we first started this part of the forum, you know, and now they're out hopefully catching the criminals where they should be.
So we've got time for just one more question, and I'll take this gentleman here, and then we just need to go a few things.
While I know not everybody in the room likes it, I actually quite like the street furniture in Market Square. I quite like the wooden stage around the tree. And I'm thinking, my real concern is, why isn't it being repaired? We've had a whole year of it just sitting there, boarded up, looking absolutely awful. We should either get rid of it, or in my opinion, just repair it and get on with it.
Thank you. Catherine's going to answer on that.
Yeah, thanks. So we do need to do something. You're absolutely right. So Hounslow Highways, we had a meeting on site with Brentford Voice and Hounslow Highways back in the summer. Hounslow Highways, we're going to look at options and price those up. I think they have got an indicative cost for replacing the stage, but I think we do have to decide, is that what we want? And we need to have a conversation around that. Do we want to replace the stage? There's a cost for replacing it like for like. If you wanted to do something different, there'd be a different cost for that. Or do we want to remove it and just, open up the square more? And I know there is, I have seen a particular strand of opinion that wants to do that. So I think you're right, we need to get a move on and decide what it is we want to do, but we need to make the right choice.
Thank you, Catherine. So please fill in the feedback forms on your seat. One person will win £20 of shopping vouchers.
Yeah, love to shop vouchers. There's a prize draw to try and get people.
It's also been brought to my attention that the Chiswick Area Forum has a higher percentage of people filling in their feedback forms, which is a source of personal pain to me. So if you could fill in that feedback form, I'd really appreciate that. Agenda item number 6, minutes of the meeting held on 19th of July.
Meeting still takes place.
I just noticed there's one moment where we referred to Sergeant Ali as Sergeant Malik. There's still one. Was agreed. Then agenda item number 7. Any other items which the chair accepts for considerations on the grounds of urgency? And then the date of the next scheduled meeting is the 18th of December 2023. Thanks to all the councillors, officers, our wonderful hosts, Brentford Free Church, members of the community for coming, local journalists, passing squirrels in the background. Great to see you all, and look forward to seeing you in the next one. Thank you very much.